hepatitis C affects a broad cross-section of the population, but there are definitely groups that are at higher risk than others. The CDC did a very nice job of demonstrating that people born between 1945 and 1965 have the highest prevalence, in other words, the highest likelihood of having hepatitis C. And so that birth cohort, they suggest, should be screened one time for hepatitis C. Now, that doesn't mean that people not born in that birth cohort era should not be screened. If they have risk factors, such as a past history of drug use, ever being in prison, ever having been on dialysis, perhaps having blood transfusions prior to 1990 or multiple surgeries prior to 1990, an era where we really didn't know how to check for hepatitis C, those individuals should also be screened.
Hepatitis C is almost 100% curable in just about every patient population. So we've heard a lot of this is the beginning of the end of hepatitis C, but I would make the argument that it's sort of the end of the beginning. But the issue now is really reaching the epidemic's base, delivering these therapeutic drugs to the highest risk populations. Injection drug users are the #1 cohort that I think right now we need to reach. This group is responsible for most of the incident or new cases of hepatitis C in the United States. So it really behooves us to try to treat them. There's this concept of treatment is prevention. So if we can deliver therapy there, we can reduce the overall prevalence of hep C, and clearly we can prevent new infections.
Hepatitis C virus is one of the most common causes of liver failure in the United States. In fact, 3 million people have hepatitis C. Within that population, baby boomers or patients who were born from 1945 to 1965 have a 5-fold increased risk of having hepatitis C as compared to the rest of the population. The CDC has created a firm guideline stating that if you were born within those years, 1945 to 1965, that you go to your primary care doctor and ask them to perform a simple blood test, a hepatitis C antibody test. That test will show you whether or not you've been exposed and create immunity to it. That test will lead to further tests to determine whether or not you have active hepatitis C and whether or not you need to be treated, because there is a new treatment that's very effective.
The prison population is another group that I think really we need to focus on. There's a large number of risk factors. Just having gone to prison in and of itself is considered a hep C risk factor. And that's a population that I think it's very easy to treat. It's almost directly observed therapy. Those patients are under the care of physicians who are watching them take their medications and nursing staff who's watching the medications be delivered. So adherence is a non-factor. And the prevalence within the prison system is much higher than the general population.
So there are a lot of groups that probably deserve to be screened, but that birth cohort, if we can screen all of those individuals, theoretically, we will diagnose 75% of all of the cases of hepatitis C in the U.S.